With the devastating toll of COVID-19 being seen in nursing homes and long-term care facilities across the country, many people are asking whether they should take their loved ones out of these homes until the pandemic is over. Right now, we're calling on Canada's foremost expert on elderly care to answer this question. Dr. Samir Sinha joins us now. Doctor, very important question. It's on top of mind for so many Canadians. So let's jump right in. What would you say to somebody who wants to bring a parent or grandparent out of a long-term care facility and bring them home?
Ben, thank you. There are over 400,000 families who are in this situation right now because that's how many people we have. And when you're hearing that we now have close to 1,000 of these homes across the country that have outbreaks, people are worried. And I don't think this is the right answer for everyone. I think the right answer is to try and make our homes as safe as possible. I think there's more we could do, but governments are now enabling people to actually bring their loved ones home or delay going into a home because they may not be as safe right now as they could be.
What advice do you give those who would say that their loved one may be too frail or they might be unable to care for them in their own home? What do they do then?
Well, I mean, this is the challenge, right? Many families have become experts in caring for their loved ones because they were probably doing it for years. They're probably providing 24/7 care. They might not have had enough government supports. And so a decision to move into a home was the right one because that was the last thing they could do. So if a family is in that situation, and many families are where they can't bring their loved ones home and it's not the right thing to do, the right thing to do is to make sure that our homes are as safe as possible. And I don't think that we're doing consistently enough things across the country to do that.
Ontario Premier Doug Ford, doctor, is talking about creating an iron ring, as he calls it, around senior care facilities. First of all, what does that mean? And would it be possible with all the staff required?
Well, this is the challenge, right? In our homes across Ontario, 80% of them before this outbreak were reporting staffing shortages. We don't pay these workers well enough. We often give them part-time work without sick benefits, for example. And so it's tough, even at the best of times, to fully staff homes. But creating an iron ring means a few things. One is not having staff work between homes. It means making sure staff in these homes have access to masks. We haven't insisted on doing that yet in Ontario across all homes. We're doing it in Toronto. And we're not making sure that these folks have that the testing that we need to have done is being done. And these are all the things that we need to do to actually create a true iron ring.
There's a big problem for a lot of families because typically if you leave a long-term care home, you have to give up your bed, and the waiting lists for these places can sometimes be years. So families are looking at choosing between two pretty awful choices. What are provinces doing about this particular issue?
Yeah, well, in Ontario, for example, what we did was we know a number of families are saying, I might have lost my job, or now that I'm working from home, I actually can care for my loved one, and I know what their needs are. So we say in these situations, talk to the director of care first. And in Ontario, we passed a specific rule on March 24th saying that families can bring their loved ones home, and that when you want to return them to their home, you can reapply and they'll be fast-tracked to the top of the list. You will not be struck off the list, and you will not actually be at the bottom again and have to wait a few years. We're trying to enable families to have the choices that work well for them.
Well, here's hoping that other provinces are looking at Ontario to see whether it's something that fits their needs. Dr. Samir Sinha, thank you very much. Really important questions and great answers. We appreciate it.
Thank you very much, Ben.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.